thank you very much for this opportunity to do this presentation, because the issue of breathing and sleep is really significant for both of us for different reasons. So we're really glad to have the opportunity to tell more people about it, because it's something that can be addressed and it can make life better.
Hello, and as Annette said, it's not only relevant to us; it's relevant to, I think, a fairly big slice of the world's population, and that's why we're so keen to get across some of our learnings about this area. We're going to be talking about how our habitual breathing can become a problem, so our everyday breathing. So we're not talking about hacks. We're talking about what we can do to change our habitual breathing, so that hopefully it will lead to more health, more restful sleep, etc. And so the focus of this presentation really is on the sleep, both the causes of poor sleep as a result of breathing, the consequences for us of that, and hopefully how to resolve it as well. So back over to Annette.
The problem that a lot of us face is that modern life has all sorts of aspects of it. We won't go into detail on that because we've done it before, really, but there are all sorts of reasons why a good proportion of us, easily 50%, breathe suboptimally. And as I well know, I was one of them. And so I think it's worth knowing what that looks like, just in case it applies to you. And before you get disappointed, if it does apply to you, you've got something that you can change that will make you feel better in some way, even if sleep is not your problem. If your breathing isn't quite right, getting it right will help you feel better. And that's really encouraging, I think. So suboptimal breathing is any one or several of the following characteristics. First one is definitely breathing through an open mouth. And most people, even those that do it, don't do it all the time. So when I ask clients if they breathe through an open mouth, often they say no, because they're not aware of it. They think they breathe through the nose all the time, and maybe find later on that they are taking breaths in through their mouths, and they come back and say, oh, I've noticed I am doing it. But that's one to be really aware of straight away. The more you can get your mouth closed, the better. That's during the day. We're talking daytime at the moment. Another one is, and this really influences sleep, is breathing too fast. This is really difficult to detect, because whilst it's a form of hyperventilation, it isn't the kind of hyperventilation where you're about to launch into a panic attack. It's simply a little bit too fast for your body's needs. And that's putting your body in a state of kind of low-grade anxiety, because you imagine breathing a little bit too fast where you can see it, you know that that person's a bit hyped up if you recognize that in somebody. And that can be going on kind of all the time in the background, not noticing it. And because you're breathing only a little bit too fast, that's your normal, and it doesn't get noticed. So that one's difficult to spot, which is doable. I've done it. Also, if your breathing is visible, so if you're seeing your shoulders go up and down, then that's probably not ideal either, because most of the activities should take place down here. And that takes some training if it's not there at the moment. But it can be done, and it feels really nice. Audible as well. If your breathing is audible, if you or other people can hear it, then it's also probably not quite right. And then the other one is not only, this doesn't only apply to mouth breathing, although it does for a lot of people. I manage this through my nose, and that's to breathe in too much air. We overeat, we overthink, and it turns out we also overbreathe. And it doesn't work. It affects the biochemistry of our the gases in our system. We end up with a little bit too much carbon dioxide, which we then need to blow off and get rid of, and that makes us breathe faster, and so it has an ongoing effect. All of these things feed into how we then breathe at night, and we've got even less control at night, so it can be a problem. So would you like to take it from there?
Yeah, so probably most of you, all of you, some of you will be aware of the sleep-related problems that are common to us today, either getting to sleep, staying asleep, waking up, then not being able to get back to sleep, feeling lousy in the morning, feeling brain fog during the day, feeling a poor focus, lack of concentration, etc. Having a really dry mouth in the morning when you wake up, having to go to the loo during the middle of the night. It can often be a result of the way that we breathe and breathing suboptimally. So it can actually affect our state day in, day out. Of course, it can also cause snoring, which can be a problem both for the snorer and the person that's having to lie next to the snorer. And it can then also lead on to something which we're hearing more and more about these days, which is sleep apnea. Now, we're going to come on to those again a little bit later, but that's just really an area, some of the examples that where our sleep can be affected through the way that we breathe. The good news is that if we do suffer from those things, we can actually influence them or impact on them positively through changing our breathing habits. And we can change our breathing habits, which we're going to come on to. The other thing as well is that I think it's an area which tends to get missed in the media, in all the articles that we read, the things we see on TV relating to poor sleep. We're always hearing about the sleep hygiene measures, the avoid blue lights for an hour or more before you go to bed, make sure that you try and set your circadian rhythms by looking at the sunshine first thing in the morning, not having too hot a bedroom, all of those kinds of things, which are great. But if your breathing is off, then those things are not going to make a difference. So if we can get our breathing right, it can also be another of the really powerful things we can do to rectify or resolve or lessen a problematic situation with sleep. So, Annette.
Yeah, so I'm going to talk about insomnia because that's my area of specialism, having been an insomniac for about 30 years. And I did feel I'd tried everything, and it never would have crossed my mind that breathing could make any kind of difference at all. And it's been a revelation to me because my sleep has got better, which you don't expect at the age of 60. It's likely to be going the other way. So there are two types of insomnia, and I've had both. The first is where you can't get to sleep. This is very often caused by having a busy mind, and the busy mind may not even be caused by the events of the day. Sometimes if you're already quite hyped without knowing it, because it can be kind of under the radar, it's hard to get to sleep. You're just kind of busy, everything's buzzing a little bit, and breathing can influence that enormously. And it can have one of two things can happen. It can be that you have an insomnia problem and that breathing makes it worse if your breathing needs attention, or it can be actually caused by breathing. So that's really good news for those for whom that is the case, because of course, if you address that, you're going to sleep better. You'll hopefully sleep better anyway. It may take some work. So if your breathing is causing you to not be able to fall asleep, it's again that what I mentioned earlier. You've got that kind of low level anxiety, probably because you're breathing a bit too fast, maybe a little bit up the chest, and it gives your brain the message that there's a reason to stay alert, and therefore you don't fall asleep, and it's difficult to do that. The same thing effectively happens with those people, which is the problem I've had more recently, wake up about 3 o'clock in the morning and can't get back to sleep. And that's, again, you probably wake up to some degree at least because of the faster breathing. If you've been doing it during the day, you are definitely going to do it at night because you breathe a little bit faster at night anyway. So if your habitual breathing is fast during the day, it's going to be fast at night. And it may be fast while you're asleep and waken you up, depending on where you're up to in your sleep cycle, which is all well and good if you can go back to sleep again straight away. But there are those of us who can't, and it's really frustrating. And especially if you then start getting to think about things that you've got to do during the day and you realize, you've only had about 4 hours sleep, how is it going to work? And so then the mind starts getting agitated as well. Breathing may then become a little bit faster because of the agitation of the mind. It's a two-way process. So slowing down breathing at that point, that's where a bit of a hack comes in. That can be really useful. I will just say, when I was first doing this, I thought my breathing was fine until I tried to slow it down a little bit more. The more is irrelevant now because I was already breathing quite fast. And I just couldn't do it. I hadn't got enough control, which is a little bit daunting. But anyway, I've practiced and it does work. I've just had a trip away and even slept in strange beds and slept. Oh, great, all good. But it's taken a long time. So really, they're the two things to look at. And I'm going to present an exercise that you can be doing, one that's probably the most important in order to address the problem of insomnia. And it's used both interventionally and as a retraining method during the day. So I'll hand back to Graham because he's got something to talk about first before we get on to the practice.
So those two problems I related earlier, snoring and sleep apnea, something that do affect quite a lot of the population, and apparently it's becoming increasingly so. It's partly linked to the fact that obesity is rising, and that can be a problem because it can put more pressure on the airways. Having a lot of fat around the neck and the throat can be an issue, and the tongue as well, which can block the airways. So snoring is a problem that I've really all through my life, certainly all through my adult life, is something that I've been accused of doing and hotly denied it, of course, as a lot of snorers do. But knowing that I do snore, because I've been aware of waking myself up sometimes, particularly when I've been lying on my back. When you're married to somebody who has insomnia and you snore, it's not the best combination of factors, and I've often been known to walk embarrassingly through to another room to allow Annette to sleep. So it became critical for me to actually address my breathing when I realised that that was a potential way out of this situation. Now, I'm not sure whether I had sleep apnea. Sleep apnea can develop as a further stage of habitual snoring, and sleep apnea is when we actually stop breathing during the night, and it can be actually really dangerous. It can affect our health, it can affect our cardiovascular system, lead to heart problems, it can cause Alzheimer's, it can cause all sorts of things, and clearly that's something that needs to be addressed. But just going back in terms of the snoring, what causes us to snore? Why do we do that? Well, if you think about our airways is relatively narrow. Some of us have more narrow airways than others. And as I said earlier, it can be affected also through having more excess fat around the neck and throat. If you imagine a pipe, and you imagine a fairly narrow pipe, and you turn water on at full pressure, it would either vibrate or it would hum. And that's a little bit like when we breathe, because it's breathing hard and fast through a narrow airway is going to cause turbulence. And that is what snoring is essentially. So how do we rectify that? How can we do that? So firstly, if we are primarily a mouth snorer, then there's an easy way to resolve it, is keep the mouth closed at night. So how do we do that? Well, there are some things that we can do. Some of them have been become a little bit controversial. They've been on things like TikTok and said this is dangerous. But I'm going to talk about them anyway, because I've actually applied this myself over the last 18 months and it's worked. One of those is to use tape. This is like a surgical tape, which what I tend to do is I tend to actually put it across my mouth vertically from top to bottom, like that, rather than all the way across. So I have still got some gaps here, which allows me still to breathe in emergency. I just completely forget I got that on. I was really, really nervous about doing that the first time I did it, thinking, oh no, that seems wrong. But actually, I woke up the next day and thought, gosh, that was easy, I didn't notice it. I've done that virtually every night for the last 18 months, until recently, and now I've started wearing something called Myo tape, which is a patented product, which actually the coach that we learned under actually introduced, and then it's basically
can I just say introduce this initially for children, because you absolutely, even if a child's snoring, they need not to be, but you mustn't tape a child's mouth shut. That just isn't the thing to do. But this might be appropriate.
We're not affiliates or anything. We don't earn anything from selling this, so we're not promoting a product. It's purely just to show you how it works and something perhaps to try out. It's basically a cotton piece of tape, which has some adhesive on the back. It's elasticated, so you can stretch it to about 30% more its normal tensile amount. Sorry, I've just got it the wrong way around now. It's got to be a little bit careful when you put it on, because it does bend a little bit. And so what I do is I just put that round my lips like so. It's a bit of a passion killer, doesn't look great. Just put it around my lips like that, and because it's got this tensile pressure, it helps. It just applies a little bit of tension to the muscles around the mouth, keeping the mouth closed. You can talk, you can breathe through it. It's very safe.
And snoring is also a passion killer. So I'd rather have that.
So that's that. You can get it in different colours as well, and there are fun ones for children as well. And it's been shown to be entirely safe. It is vegan as well, if that's a concern for anyone. It's not got any nasties in it. So that's really helped me, and it helps me to keep my mouth closed. Problem is for me as well, though, I have a very narrow nasal airway. I've been blessed with quite a small nose. I blame my parents for that. And I think that I am a bit of a nose snorer as well. So, okay, got the mouth closed, but I've still got the problem with nose snoring. Something else that I wear as well. So you imagine me in bed at night, it really must be quite a sight, but I don't look at myself at night. So this is something that may be familiar to some of you. Often you see athletes wearing these. It's just a nasal strip that's been around for quite a while now. You just take the adhesive off, put it over the bridge of your nose like that, and it just pulls open the nasal cavities a little bit.
You can try it now if you like. You pull the sides of either side of your nose, you tend to be able to breathe better.
Yeah, it's the cockle maneuver, just doing that, which helps to open the nasal passages. So I wear this at night as well, and that really does help to keep my breathing through the nose clearer. I also wear this for jogging because I've now trained myself to run. I run around about 3-4 kilometers, so not a huge amount, but I've managed to do that now, not once breathing through my mouth. And I wear this, and it helps me to breathe more easily through my nose. So that's two things that you can do to help with snoring. And then there's another thing. If you don't want to wear there's something called the nasal dilator. This one's plastic, and you just put that into your nose, and it kind of prizes your nostrils open a bit. I personally find that a little bit uncomfortable, so I don't use that, but it is there as another option. So that's some easy ways to try and keep your airways open at night. The other thing, of course, is to train your breathing during the daytime, so that when you are breathing at night, you change the signal to your brain. It becomes more habitual that you close your mouth at night. And also you train yourself to breathe more slowly and more gently, which reduces that turbulence at night. So there are things that we can do. And if we can reduce that risk of sleep apnea, which, as I say, is the next kind of step on from snoring, then we've done ourselves a lot of favors. Sleep apnea is something which I think the diagnosis is, there's a lot of people that know they have it. There's a lot of people who are undiagnosed. And it can be really, really dangerous, not just for the sufferer, but also for other people. Because, for example, imagine pilots, taxi drivers, lorry drivers, anyone driving a car, sleeping at the wheel, sleeping at the controls, because due to sleep apnea, their sleep has been affected so much for a period of time or immediately the night before that they actually fall asleep. Now, if that is diagnosed, if they've got a job where they're actually having to control machinery or flying or driving, then they're usually not allowed to do that, certainly in some countries, I know in the United States. So it is a big problem. So it's definitely worth doing something about it. And there are things that you can do, like the CPAP machines, which open up the airways. But if you can do it naturally through retraining of breathing, then why not? So that's covered the kind of areas of sleep disturbances I wanted to talk about. So back to Annette.
Okay, so this exercise is really simple. I'm going to ask you if you try it to make it fit you rather than what I'm about to demonstrate, because some people will find it very easy to do, and other people will find that their breathing needs a little bit more than I'm offering here. So make it fit you. It will become apparent what I mean. This will, with practice, this will help your daytime breathing such that your nighttime breathing is better. And that lighter breathing, if it becomes more familiar to your body, is going to happen at night and are going to impact on snoring, for example, because you won't get that turbulence anymore. You can try it if you like. If you try snoring just through your nose, you'll find you have to take in quite a lot of air for that to happen. Taking a really soft amount of air, a small amount, and breathe softly, you don't have the turbulence anymore. So it's kind of impossible. But that's the thing that needs to be trained, and that that definitely, all of this takes time. It takes an investment. It's not Instagrammable. It's not got big flashing lights. It's just one of those things that you kind of have to nurture yourself towards it. But it's a lovely thing to do, and being able to sleep if you've not slept well for a long period, or your sleep has been poor quality or whatever, it makes such a difference to your entire life. I can't recommend it enough. So first and foremost, it's taking in less air. So I'm going to assume that everybody at the moment, including me, are breathing like this. So breathing in and breathing out, breathing in and breathing out. And what I'm going to ask you to do as practice now is to take in a little bit less air. So cut it down. So breathe in less air, and as you breathe out, can you make that out breath a little bit longer than the inhale? So take a small breath in and a soft, relaxed and gentle breath out. So a small, gentle breath in and a soft, gentle and slower breath out. And a slow breath in and a soft, relaxed and gentle breath out. And that again, slow breath in and a soft, relaxed and gentle breath out. It may be that you can cut it down a little bit more, and if you can't, don't. Just do what's right for you. So take it a little less air in now. Small breath in, and slow, relaxed, and gentle breath out. Slow breath in, and soft, relaxed, and gentle breath out. And slow breath in, and soft, relaxed, and gentle breath out. If you can do it, keep going for a few more minutes, so about 5 minutes, while I explain to you why this is so valuable. The taking in the less air is doing what I mentioned with the snoring in particular. It reduces the turbulence, but also by practicing this during the day, you're retraining your body not to breathe dysfunctionally. I will just say, I'm going to say that obviously there's always one person who's big on the screen. There is one person who's big on the screen at the moment, who I really won't mention. And I know from the look on her face that she's getting this exactly right. For some reason, the eyes go a little bit glazed when this is happening. So it's really nice to see, because I'm obviously getting the feedback there. So keep it going if you can, keep it nice and slow. In terms of the slow exhale, why is that slower? And that's because you are stimulating the parasympathetic nervous system when you do this. When you breathe a little bit too fast and hard, or upper chest, whatever it is, you're in sympathetic mode. That's the one where you're getting ready for fight and flight. But this soft, relaxed one, that's getting you ready for rest and digest. So it's the parasympathetic nervous system that's coming into play with this. As you do so, you're also stimulating that really big nerve that runs throughout the body called the vagus nerve. This has a calming effect too. And the wonderful thing about this is that by training this, and you do train it, it gets better, and those effects stay with you more. So the fact that you're not doing it right now, if that's the case, if you're not doing it right now, but you do it later, kind of doesn't matter, because you will get the effects that last. And the more you train it, the more the effects last. So it is kind of vagal stimulation and training at the same time. Now, why would you want to stimulate the vagus nerve? Well, it has a calming effect in its own right. So that's keeping you, kind of giving you a calmness that you can use throughout the day and help you to sleep. It also stimulates the production of the first ever discovered neurotransmitter called acetylcholine. And that in itself slows the heart rate. So that also helps us sleep and feeling calm. Plus, it's been known to be linked in some way with cognition. And interestingly, when people who have Alzheimer's and Parkinson's, for example, are tested, they don't have enough of this. So it's lacking in them, which would suggest that promoting it at night for your own end and during the day for later on is useful to you. Because I think we're probably, if you are an insomniac, you probably know when you've had any information about insomnia, rather than give you the most useful solutions to the problem, because that's hard to do, they give you all the reasons why you should be sleeping well. And yes, I know this, and I don't want to hear that I might have Alzheimer's. This is, it's not ideal. And this genuinely is, for many people, a help or even a solution. So there's another really exciting thing as well, because you get told very often, especially when you go looking at these things about insomnia, when you're not sleeping, your brain doesn't get that kind of washing effect that comes with sleep. It's called the cerebrospinal fluid that kind of washes your brain, if you like, and clears away the debris from the day before. And we're given to believe that that happens exclusively during sleep. Turns out it doesn't. It happens also with slow breathing. And again, I'm talking about the slow exhalation in particular. If that part is slow, then it does still happen. That clearing still happens, and that's really encouraging. There's another exciting one as well. The slow breathing with the slow exhale stimulates the production of melatonin. Melatonin is often known as the sleep hormone, and for obvious reasons then, it may help with sleep. I don't know how much it produces. I don't know if that's been measured. There's nothing that I've come across that says either way. That's useful as well. I mean, I probably, I think I'm right in saying that in the UK in particular, where some of the people watching this are likely to be, you can't buy melatonin over the counter. So produce your own. Why not? Bypass that anyway. It's cheaper. I just don't know how much you would get, but it's worth doing. It's worth doing even if sleep is not a problem for you, simply because it's useful for immunity. We do need it. It's not just a sleep hormone. It's got other. It's an antioxidant, a powerful antioxidant, but it's got other uses as well. And then the other one that I found most recently that I find extremely interesting and quite exciting. This was a study done in, I think it was in Thailand, where people were asked to do a certain amount of slow breathing. They were given a specific rate for this, although that may not be as key as just slowing down your breathing. And what happened with them is they were having their brain waves measured. And so they started off in beta, which is where we all are when we're awake, usually, typically. You may not be if you're still doing this exercise. You may be somewhere slightly further on, because the slow breathing within a few minutes with these participants led to the alpha waves, so the next stage down, which is more relaxing, it's calming. But what's really exciting is not only did it get to theta, which is calmer still, in some cases, and I don't know how long it took them, but it took them to delta as well. And that's sleep. They were still awake. So it is possible to do conscious sleeping and to have a number of the effects that sleep gives you. So this means that for those of us that do wake up in the morning and are struggling to get early in the morning and struggling to get back to sleep, breathe slowly anyway. Make sure your exhale is a little bit slower, because even if you don't get back to sleep, you may find, I'm an experiment of one, so it's not a great number, but you may find that your day is better anyway. Do it as mindfully as you can, so become aware of your breathing. There is more to take on board, and clearly we can't demonstrate this all at one go, because ideally you need to be breathing with your diaphragm fully engaged rather than your chest. And there is an optimum breathing rate. Please don't worry about that until you've got this sorted, because what very often happens is people want to get to that optimum breathing rate and they breathe then too big. So they're compromising their own biochemistry by doing that, and very often say, well, this doesn't work, and I feel dizzy when I'm doing it. This is why I'm encouraging this one first, because it's in some ways the most difficult. It's the one that's most lacking for most people, and it will lead you to the others much more easily. So this slow, relaxed breathing, slow in and even slower out. If you can train this during the day, take a few moments out if you're able to train this. Sit down quietly, maybe 5 minutes at a time. Ideally, the optimum suggestion is usually about 60 minutes over the course of the day, but 15 or even 20 minutes of it can be before you go to bed. It's going to hopefully give you the best quality of sleep and actual duration of sleep as well. It may take time. I would suggest it's taken me about half a year to get to where I am now, and I'm still hoping there's room for improvement. But my life is a lot. The result of it, I do feel a lot happier because I'm not stressed throughout the day and so anxious. It's so much nicer, and I wish that for anybody whose sleep is a problem. So back to Graham to round this off a bit, and you can stop with the slow breathing now if you like. If you're willing to give any feedback as we finish this, I'd be really interested to know, because you're likely to, if you kept it going, likely to have felt quite calm, possibly even sleepy, which is fine. That's how it's supposed to be. So
yeah, just anecdotally as well, we tend to do a 15-minute breathing exercise like that, pretty early in the evening. Sit down, just do it, and more often than not, I fall asleep. I don't want to, because I want to actually get the full benefit of the exercise. But after about 7 minutes, I'm asleep, and then I wake up with a start when the timer goes off at 15 minutes past. So it just shows how relaxing this type of breathing can be. And at the end of the day, I'm not bothered about falling asleep, because I know that I'm relaxed enough to do that. But I do want to keep practicing the breathing, because the more we do that, we train our respiration center of our brain, so that our breathing becomes less pronounced, more soft. And isn't it strange that we're never really told this? We wouldn't be told this by doctors, that breathing, when breathing is concerned, less is more. We're usually encouraged to take big, deep breaths, but that's actually, deep doesn't mean big. Deep means low down, using the diaphragm. That can be really gentle. So when someone tells you to take a deep breath, you're feeling that you need to relax or whatever, just remember, don't take a big breath. Just take a nice, slow, gentle breath through your nose, so that you feel your diaphragm going up and down, and your ribs expanding laterally and outwards. And that is proper deep breathing. I just wanted to just reference something I said earlier about sleep apnea. If anyone does have sleep apnea, I would advise them against taping their mouths, at least fully, and
especially if it's severe.
Better to use the myotape, because that's more safe. Because there is something called mouth pumping, where people who often who have severe apnea, it can cause them to do this mouth pumping, and you need to allow the air to come out of your mouth. Taping wouldn't be ideal for them, but for the majority of us, it shouldn't be a problem. But to be sure, I would recommend probably using the myotape, goes around the mouth, rather than taping the mouth, because that is an area of controversy, and we just
that
want
could
to
still,
make
that could still be safe.
Yes,
as long as it's that way. Don't take yourself up like a parcel. You don't.
Yeah, that's the main thing. So this thing is, we talked about sleeping, but the solution isn't an overnight thing, because if you've been habitually breathing incorrectly for most of your life, it's impossible to change things overnight. And that's where the breathing re-education comes in. This is what we do. So we work with people to actually retrain them over a period of time how to breathe as they should be. Now, if you've got severe respiratory issues, if you've got severe panic, etc., even slowing your breathing down or breathing softly a small amount might send you into a spin, because it's completely, I'm not used to that. So it's got to be done very carefully, and it's got to be tailored to each client. It's also a case that clients need to remain motivated and accountable to what they're doing, because you can show people an exercise and you can say, go and do this at home now. And a lot of people might try it for a few days and then it kind of tapers off. But that's not going to bring about the changes. So when we work with clients, we do it over a series of weeks, usually about 6 to 8 weeks, I would say, until they've got to a position where they know what they're doing and they're seeing the changes, and seeing the changes is its own motivation.